And thanks so much to all the One Health scholars who provided us with the summaries of their research. It's all really great. And I think it's a really nice wrap up too of kind of taking a look at One Health means. You know, I think as we all talked about, there are very big global problems that sometimes seem a little overwhelming, you know, kind of talking about encroaching development on biodiversity, sustainable agriculture, affecting physical and mental health of people and animals. But understanding that, you know, you have all of these parts, and as long as, you know, we all kind of work on our parts, and then as part of our research, listen to the other sectors, and every once in a while form these teams where we can collaborate together while still working on our little niche, and just kind of open to transdisciplinary research, I think is where it's really gonna create that One Health concept. And so kind of being here today. So just to wrap up, thanks everyone for coming. Both Dr. Roosa and I are just going to give a couple updates as well on kind of this One Health initiative that's kind of getting really ramped up this year. One thing that is pretty awesome news is I think if you saw in the chat, Dr. Deborah Miller, who is the director of this initiative, has just been in kind of a meeting with getting that One Health minor approved, and we're getting very close with just a little bit extra tweaks to getting that One Health minor available to undergraduate and graduate students next year. So that's going to be a really good thing to have people be aware of this One Health concept as they start out in their academic career. The other thing I wanted to mention is we started a seed grant to promote One Health research, and that just closed this year. And so it's in the process of review, where we will be giving out both large and small grants to transdisciplinary teams with One Health research ideas. And hopefully this will be a continuing grant opportunity, you know, every year in the fall. So definitely watch out for that, and also watch out to see who and what research will be funded in this program. So I think that's all I have to say, so I'm going to pass the ball to Dr. Roosa.
Okay. One thing I will note is let me see if I can screen share here. If you're interested in the research that you've been hearing from our One Health scholars, you can check it out also on our One Health Initiative website, which I can drop in the chat box in a minute. And on the website, you can see different news highlights of the research or of the One Health scholar that can be found under this tab. So any of those slides you saw, you can find their information on here if you're interested in the research that they were presenting today, or if you're interested in looking at what else there is that didn't present today. Also, if you just keep an eye on that website, we have your emails if you registered for this event, but if by chance you're here and you didn't register, you can drop your email in the chat and we can add you to a list, but we'll likely be starting a One Health initiative sort of email list to keep everyone up to date on the different events that are going on. We're planning for some seminar series, as well as hoping for a 1 to 3 day workshop in fall 2021. So just things that may be happening. Also, I know our one working group, the Consilience working group, is possibly planning an event for towards the end of spring 2021. So exciting things coming up. I guess I can talk about what One Health is to me and what I'm excited about working with this initiative. So I just started with the One Health initiative in September. My background is in math and public health. So when I was starting to look for postdocs, I was really interested in Dr. Nina Pfefferman's work, who was introduced earlier, because my research is primarily in mathematical modeling of infectious diseases. But then when we started talking, and I was talking about my passion for all being like holistic health, as well as interdisciplinary research and building all these different collaborations across different disciplines, we both kind of just agree like, oh wow, this One Health position that's opening up would be really perfect for it. And it's been really great getting started. One thing another point, just going back to the Consilience working group, so basically science of team science, and we're really excited about that. And I enjoyed that aspect. It's not just building the collaboration, like, oh, look, I found a person who does this research and automatically, bam, we have this great collaboration. I think everyone here knows that's not always the case. So how can we build strong collaborations with people who will work well together, and how can we keep them strong and keep people collaborating on these different research ideas? So yeah, if you're interested in any of the different working groups, feel free to contact us. There's a lot going on. I know we have a vector-borne research group, the Consilience working group. I know Becky's in charge of a couple, if you want to jump in and talk about yours.
Yeah, off the top of my head, we also have a microbiome working group, because that seems to be something that a lot of these different teams have a commonality in, as well as a lot of people mentioned there is a chronic wasting disease working group using a lot of expertise across disciplines. And yeah, I'm going to throw it out to Alyssa, our communication specialist, for any last minute details. And again, we really appreciate you coming out for this.
I don't have too much to add, just to echo their thanks for joining us. And if you want to check the One Health Day page on our website, we will have all of these presentations uploaded probably by the end of the week. And that is going to serve as an archive for future One Health Day presentations as well. So just keep an eye out for those. And that's all. I guess I will say goodbye and thank you on behalf of all of us. And everyone, have a great Tuesday.